I think many people buy into three myths about American healthcare, and that this really deadens us to the realities. The first is that because American healthcare is the most expensive in the world, it must be the best. The reality is that although we spend more per capita on healthcare than any people in the world by a long shot, our health outcomes are at or near the bottom compared to those of other developed countries. We have been ranked about 37th among countries in the world in health outcomes, somewhere on a par with Serbia. The second myth is that because we have the most elaborate and most expensive medical technology in the world, that this must translate into medical excellence. The reality is that although medical technology has helped us in certain areas, for instance, the management of trauma and critical conditions, it has really served us very poorly in terms of creating cost-effective health care. One of the main reasons why American healthcare is so expensive is that our interventions are based in expensive technology. There are many low-tech methods of intervening in disease that our doctors simply don't learn. Also, all of our healthcare system is geared toward intervention in established disease, and the vast majority of that disease is lifestyle related and therefore preventable. The third myth is that we have the best medical schools and research institutions in the world that are producing the best physicians and the best research in the world. The fact is that we have great medical infrastructure in terms of bricks and mortar. We have a very highly trained faculty, but the curriculums of medical school, and this is also true of nursing schools and pharmacy schools, omits very large areas that are extremely relevant to health and healing. For example, our health professionals learn next to nothing about nutrition. They don't learn about botanical medicine. They don't learn about mind-body interactions. And in terms of research, we conduct a great deal of research, but the amount of that that's relevant to health and healing and to developing cost-effective treatment strategies is very low. I'm very happy to see healthcare reform now a major topic in the news, and I'm happy to see the President administration and the Congress taking up the issue. But most of the debate that I see centers on trying to give more people access to the present system and figuring out how to pay for it. And that's not what we should be concerned about. Any attempt to reform healthcare that does not include a radical transformation of medicine and a huge shift of energy away from disease intervention to health promotion and disease prevention is doomed to fail. Even if we create the most clever national system, single payer system of healthcare, it will be taken down eventually by unmanageable cost unless we change the way we're doing things. To me, health is it's an inner state of balance and resilience that allows you to move through life and not get hurt by all the things out there that have the potential to hurt you. An image that I like to use to illustrate that is a child's knockdown toy with a weighted bottom. You can knock it over, it bounces back to center. You can hold it down, it will stay down as long as you hold it, but you let go, it bounces back to center. If you have that kind of inner springiness or resilience, you can interact with germs and not get infections. You can interact with allergens, not have allergic responses. You can interact with toxins and not be harmed. That's a quality that we're all born with. This is an innate quality, but it's up to you to learn how to protect that and enhance it as you go through life. So I think ultimately health is an individual responsibility. But I think it's also the responsibility of society to facilitate people taking responsibility for their own health. So that is to make the lifestyle choices that support health easier and more affordable. In order to solve the healthcare crisis, first of all, we need to shift our energies and focus away from intervention in established disease and really focus on disease prevention and health promotion. I think we have to end the administrative waste of the present system and develop an efficient model of delivering health care to all. And we have to develop a new model of medicine that emphasizes low-tech, effective approaches that are much more cost-effective than the means that we now use. I would include, by the way, pharmaceutical drugs in the high-tech approaches that we're now locked into for the treatment of disease. It never occurs to many doctors or many patients that it is possible to manage disease very well by methods other than giving pharmaceutical drugs. So I think we need a whole new model of medicine, and in order to do that, we need a new model of medical education. We also have to train pharmacists differently. We have to train nurses differently and allied health professionals. So I think it's this kind of radical change in the nature of medicine that has to be foundational to building a more functional and more cost-effective system of healthcare.